Welcome to the network of Burn Healing Foundation, dedicated to providing reconstructive surgery and comprehensive care to underprivileged burn survivors. I, Aarti Ahuja, CEO of Burn Healing Foundation, welcome you to Champion of Burns, our flagship podcast series. Founded by our chairperson, Dr. Rajiv Ahuja, a distinguished plastic and burn surgeon with over 4 decades of global experience in the field. Dr. Ahuja's contribution to burn care extends far beyond the operating room. As an academician, he has published extensively in peer-reviewed international journals and authored chapters in leading burns and plastic surgery textbook. He currently serves on editorial boards of several international journals and was honored with Lifetime Achievement Award from International Society for Burn Injuries in 2022 for his exceptional contributions to the field and community. Dr. Ahuja has led numerous prestigious leadership positions, including Chairman of the Trust at Associations of Plastic Surgeons of India, Past President of International Society of Burn Injuries, Founder President of Asia Pacific Burn Association, and ex-head of Department of Burns, Plastic, Maxillofacial and Microvascular Surgery, Loknayak Hospital, Mamsi. Presently at Sir Gangaram Hospital in New Delhi, his vision and expertise has shaped burn care protocols and policies in the country, Asia, and beyond. At the Burn Healing Foundation, we believe that true recovery encompasses not just medical treatment, but holistic support that addresses the physical, emotional, and social dimension of healing. Through this podcast series, we bring you voices of our partner hospital doctors who are making comprehensive care possible, surgeons pioneering reconstructive techniques, addressing trauma and resilience, helping survivors rebuilding their lives with courage and creating pathways to healing that might otherwise remain closed. Each episode explores multifaceted world of burn care and rehabilitation in India, where access to specialized treatment remains a critical challenge. You will hear stories of transformation, learn about innovative approaches to psychosocial rehab, and discover how collective action is creating sustainable change for burn survivors across our communities. This is more than a podcast about medical care. It's about the human spirit, the power of community, and the belief that every person deserves the opportunity to heal completely, body, mind, and spirit. Our anchor for the podcast series is Dr. Viswa Chaitanya. He is a burns, plastic, and reconstructive surgeon trained at Kilpauk Medical College, specializing in acute burn care, complex reconstruction, pediatric burns, and skin banking. He has presented national-level research on skin allografting and advanced wound care practices, currently serving at Grace Kenneth Foundation Hospital in Madurai and our most recent partner hospital in the BHF network. Dr. Chaitanya is committed to providing evidence-based reconstructive care that integrates clinical excellence, ethical tissue donation practices, community engagement, and global collaboration to enhance both functional and aesthetic outcomes for patients. Thank you, Dr. Chaitanya, for bringing the podcast series to light. We are honored to welcome Dr. Umar Farooq Baba. He's also the guest editor of our BHF blog, where he brings invaluable leadership and clinical wisdom to the Burn Healing Foundation network. Dr. Baba is a board-certified plastic surgeon serving as additional professor at the prestigious Sher-e-Kashmir Institute of Medical Sciences in Srinagar, India. His editorial excellence spans multiple platforms. He serves as an associate editor of PRS Global and assistant editor of the Journal of Medical Sciences, while contributing to editorial boards of various national and international journals. With 71 publications in reputed journals and extensive peer review experience, Dr. Baba brings both scholarly rigor and practical expertise to our community. His leadership roles include ex-ESCO member of APSI and ISSH, Joint Secretary of NAVI, and active membership in ISSH research wing and academic teams. Through his guest editorship, Dr. Baba enriches our mission of holistic healing by bridging clinical excellence with compassionate, comprehensive care that defines the Burn Healing Foundation's approach to supporting burn survivors. We once again welcome you both. Over to you, Dr. Chaitanya.
Good evening, everyone. Today on Champions of Burns podcast episode 3, it is honor today to welcome Dr. Umar Farooq, sir, a senior plastic reconstructive surgeon, an academic leader, and a passionate advocate for burns and prevention and rehabilitation. With decades of experience in managing complex burn injuries, his work has shaped both clinical practice and academic thought in burn across the country. Beyond the operating room, he is a mentor, researcher, educator who continues to inspire the next generation of surgeons. We are privileged to have with us today on the Champions of Burns. We welcome you, sir.
Thanks a lot. Thanks a lot. I am really feeling humbled by your introduction. Thank you.
Sir, it is our privilege to have you on the Burns Healing Foundation, sir. So we are in a same platform and doing more about burns cases and helping the people, sir.
Absolutely.
सर आपको पहली बार ये बर्न फील्ड केयर में फिलांथ्रेपी में कैसा स्टार्ट हुआ था सर? आपको आपका इंटरेस्ट कैसा शुरू हुआ था?
Actually, I can say that the interest in that, जो मेरा ये बड़ा, it was not the personal thing. Actually, I went into the burn management through my experience while going. When the burns got hold of me, or you can say I got hold of the burns, I don't know. While going through my experience when I started my career in the plastic and reconstructive, burns is an integral part of plastic surgery. So while going through that, it hold me with a strong hand, that I have to do something in this. Because I have found two fields when I entered this plastic surgery: diabetic feet as well as the burns. These are, I think, very few people want to go into this field. If you see today also, the pass outs of the plastic, they don't want to take the burns as their career. Very few people are taking that because they don't feel there's a kick. But This is not the truth. So I have been with the burns, I have been taken into the philanthropy, or you can say advocacy of the burn, by the gradual evolution, while treating the patients, while coming in contact with the patients, while managing the patients. So it evolved like that. Not that I chose it. It was automatically, it came to me and I took it strongly within me.
Yes.
That is the thing.
In our college, I studied from Keel Park Medical College. There is a board inside the hospital, first board. Those who serve the burns patient have a special place in heaven, sir. So that reminds of you that it was chosen for you because it is instead of burns, you have chosen. Burns has chosen you.
So that is the thing, that if you develop interest in something.
Yes, sir.
Actually, treating the burns is different thing. I can tell you a story like treating the burn is not treating an ordinary patient.
Yeah.
There are many surprises come to me when I came to the burns.
Yes.
It is not like that. I was not knowing. If you say you are also a medical student, everybody here is a medical student. If you see, we have also read burns in our undergraduation, but we have not taken it so seriously. When I entered into the burns, it was like it's the burn only. I was knowing burns that it is up to the skin only.
Yeah.
I was not knowing that burns is a systemic disease.
Yeah.
I can tell you one incident. One of my cousins, I have many stories. Sorry, we should not lose the track. One of my cousins, he is an engineer by profession. He was junior to me. So one day while examining, they had some inspection. He is senior and he had become the engineer in some cement factory. While having inspection, there was some gas came out. There was a leakage or like that. So whole of his face got burned. His face, neck, upper torso and the limbs. And he called me, what happened? He told me that I went to your hospital for the treatment. I had a burn. My another co-worker, co-engineer here also has a burn on the face and we are admitted. And they are telling us, your resident is telling me a different story, that he wants to castrate me. He's telling me it's a systemic disease. I told him, no, I have a burn on the face. I have a burn on the arms and hands. What are you telling me that you need to give fluids and all that? So this is the condition with the learned people. He's a gold medalist. He has read many books, but basics of the burns we lack.
Yeah.
So he was thinking, what I was surprised that we know the burns is the tray on the skin deep. We don't know it is a systemic ailment.
Yeah.
That is the thing. That surprised many things, because what fundamental thing we lack in our country is the awareness.
Yes, sir.
Awareness is very less. If you even go to the medicos, I'm
Yes, sir.
sorry to say that if they are not in this, actually
Field.
burn specialty within specialty.
Yeah.
Burn is a specialty within the plastic surgery. So plastic surgery itself is a specialty.
Yes.
So many people have a lot of myths, even in the learned people, a lot of myths about the burns, and
Yes.
not talk of the medicos, other people who are not in the medicine.
Yes. You're rightly saying, sir. Sir, as we go ahead, what was your first encounter with the burn survivor community and how did it impact you, sir?
Burn survivor community, I can say one of my mentors was my guide during the plastic surgery. He is Dr. M. Inam Zarur. He's a very senior plastic surgeon. One day, he admitted a patient, young boy, he must be 9th or 10th class standard student, and he had electric burn.
Okay.
He was in a far-flung village where he saw a wire going on in the ground. He picked it up and he got the shock. So he was brought to the hospital. He had burns on his arm, he had burns on his hand and the feet. Then I saw that we amputated his one digit. Then other was very deformed digit. We did many flaps or surgeries on that. We have to amputate his toes also. But the thing I saw in him, he's still in contact with me. He's now grown up. So he had that vigor that while counseling, we told him that you will be all right. You have to read. You have to write. Yes, I have to read. He was very optimistic. His family was also optimistic. Then we were training. Then he passed his 12th. Then he went to Bhopal. I still remember. He's in Bhopal. He did their masters in English literature. Then he was sending his pictures to me, but there was a communication there, his teachers and all that. Then he came back. Then he did his MPhil. So this is a success story that with this difficulty, he could write also. With only 2 fingers or 2.5 fingers, you can say, he could write.
Oh, that is a really
So
inspiration.
that whatever was his choice, whatever he wanted to be, he went. Then he did his PhD from the university.
Oh,
And he is writing for the papers also. So this gives when such a child who had in the childhood such a tragedy, so he can go to such height. And one day every time, but any good news he has, he shares it with me. Because then what I was telling you share a bond with the patient. It is not, actually, I want to say that it is not treating a patient. You have a whole that you become so close to the patient that he shares his joys and sorrows with you.
Yeah.
So you become very close to his heart. Then he told me that I have to go for the interview, that I have done PhD. Maybe I will be selected for the college. So he got selected for the AP, assistant professor in the college, higher education. He's working there. When he has to get marriage, he said that I am like this matrimonial, these prospects are coming for me, like that. So this way you become so close to the patient and away from. I am saying that our work, when you go to the burns very deeply, it does not end with the healing of the wounds. It is not like that you have a raw area, you have a burn period, you have covered the wound, you have put the graft. I think the journey begins there.
Yes.
When you discharge a patient, when he tries to reintegrate into the society, first in the family, he should be accepted in the family first, then the society. He should go into his own job.
Yeah.
So the actual journey for the burn begins when after he survives, he goes into the society.
Yes.
That
is a real task, sir, actually.
That is the real task. That is why I am telling you, जैसे हम कहते हैं, advocacy, these are very common words. Advocacy is a very common word. What is advocacy simply? अगर आप देखेंगे हिंदी में advocacy क्या कहता है? It is the part of your supporting somebody. जैसे हम हिंदी में कहते हैं समर्थन.
Yes, sir.
So you are supporting something. You are supporting maybe a person, supporting maybe an idea, supporting maybe like that. So you are supporting the journey of a burn patient through all his struggles. His struggle doesn't start with the burn. It is a one part of the struggle. He is struggling first with his life when he is with you in the hospital, in the burn ward. Then after this struggle, the actual struggle begins. His struggle begins when he leaves the hospital. That is the thing. And philanthropy we are talking about.
Right.
That philanthropy comes after he is discharged.
Yeah.
And what is needed, I can say you this advocacy, philanthropy is you can say that the composite treatment of the patient.
Yes.
You have not to treat the wound only.
Yeah.
Once I had read somewhere that a burned person is burned for life. He has scars, not only in the body, he has scarred, his psyche is scarred.
Oh.
His inner self is also scarred.
Yeah.
Because he is seeing that he has something unusual from the others.
Yeah.
And he has to carry these things whole life.
Throughout the life.
So
Yes.
to come with this reality, it is very important. So psychological well-being, psychological help, psychological support is very important.
Thank you.
Even the physiotherapy, physiotherapical support, that is very important. So for the burns, it is not only that you cover the wound, you have patient is surviving. It is not enough. There is a separate world apart from this. If you want to give a holistic treatment to the patient, holistic management of the patient, holistic management for me in the patient is that he goes to his pre-injury status.
Yes, sir.
He grows to if he is a boy, he has to go to school. He should be welcome there. He should be welcome in the family. His family, parents, his wife, his children should welcome him. He
Right.
should be welcome in the society. He
Yeah.
should not shy off from going out in the party or whatever.
Yes, sir. It is actually going into the trauma. First, he has to get from the out of the trauma, then into the psychological trauma, then into the mental trauma, then into the family, and into the society. That is
I
where-
am telling, in my opinions, this physical trauma is easy to control, and
Yes.
I think it is easy to treat. You have many options for that because you are seeing it. His psyche, you are not seeing. It is invisible thing. You are
Yes,
not
sir.
seeing his psyche,
Yeah, right.
and his psyche is scarred again and again by others because he is not acceptable.
Yes, sir.
And I am always saying one thing, that don't pity on these patients.
Yeah.
So give them opportunity. वो ये बेचारा है, देखते नहीं हो इसकी क्या दशा हो गई है. You are not seeing him. This will not help him. Don't pity on him.
Yeah.
Give him opportunity. Give him freedom. Give him independence.
Actually, that is the reason Burns Healing Foundation is actually planning a platform for freedom and free of cost to get the surgeries, everything done, sir. And
Yeah, that's the
together and doing the same thing for the noble cause. Thanks for the Burns Healing Foundation, sir. Actually, really, sir. Sir, actually, as you yes, sir. Go ahead, sir. Go ahead, sir.
actually what the Burn Healing Foundation is doing. It's a remarkable job.
Yeah, yes.
Because basically burns in our society, in our country is, if you call it a disease, let us call it a disease now. If it is a disease, it's a disease of the poor.
Yes, sir.
And when a person cannot afford anything for him, what can he do? And for that matter, when we are treating a patient, to be honest, all the surgeons, all the burn surgeons, their first focus is on the life.
Right.
We don't focus on other things. And now I realize that this is wrong. I have come a long way now. This is wrong. We should take what I have taken advice from my mentor, my teacher, Dr. H. Mani. He happens to be the first student of Ahuja, sir.
Oh, very
If,
nice.
Dr. Aarti, you know, Adil Hafiz is the first student of Ahuja, sir. So he gives me advice many times that treat the patient as a whole. For that matter, any patient. You don't treat the nose, you don't treat the hand in the hand burn, you don't treat the scalp and this, you don't treat the foot burn, you don't treat that part which is injured. You treat the patient as a whole. It is not a commodity. Some people are of the fond that, especially in aesthetics, they say that our client. I totally disagree with this term. Patient is not a client. You cannot call him a client.
Right.
He's a subjective thing. You cannot come, he's a subject.
Right,
He
sir.
cannot be a client. So treat the patient as a whole. He's a patient.
Yeah.
Actually, we have to think that whatever we are this time, because of patients, everybody has evolved through the patient. If I am here, I have learned from the patients.
Right.
You are at your position, you have learned from the patients.
Every patient
So,
is a different story.
Yeah, this is very important. Our profession is as such a sanctity that if you take a patient for the surgery, maybe for the contracture,
Yes, sir.
patient is not, you have given him anesthesia. Patient give you food authority. किसी को भी बोलो आप जैसे ओपीडी क्या करना है, नहीं नहीं माता जी बोलो हाथ का क्या करना है, अरे बेटा क्या बोलूं जो करना हो ठीक कर दो.
Yes.
She has such a confidence in you that वो she puts everything. भगवान के बाद तो आप ही हो ना, ऊपर वाला तो है और आप ही हो. जो आपको करना है वो करो जी आप, बस ये मेरा हाथ ठीक कर दो.
बस
तो मैं हाथ से खाना खा लूं,
वही सही बात.
काम कर लूं. It is like that. So people are taking you, treating you from above. Above is God, then this is your place. So you have to respect it that way also.
सही बात. Sir, as you mentioned about your mentors, first student of ours, sir, who are your early mentors or influencers in this field, sir, and what did they teach you, sir?
Actually, if I recall correctly, in plastic surgery, I had 3 mentors. One was our ex-HOD. He is now no more.
Oh,
He be in peace. M.A. Darzi. He used to be a friend of Ahuja sir also.
oh,
So M.A. Darzi was one of the fewer, you can say, early plastic surgeons from our place. So then comes the M. Inam Zaru. He was my guide. He was my guide. He is one of my mentors. And none is the Adil Hafiz, who happens to be the student of Dr. Ahuja sir. These are my mentors who have taught me, and they were very good, very affectionate. And in the end, their motto, I have seen that, especially in our institution where we have been, academics has a very much value.
yes.
And accountability. If a patient is there, you are accountable for the same. That they have taught. What I was telling you, that you see the patient in toto, not see his hand, his arm, his ear, his eye. You see him as a whole.
Yes, sir.
He is not a commodity.
Yeah.
He's a patient.
Yes, sir.
Yeah.
Sir, take us back to your pivotal moment when you realized burn care and survivor support would become your life mission, sir.
Life mission, I can say, while working in the burn, it automatically came to my mind that it is now my bread and butter, that I have to live with it. And especially I'm thankful to my family. They have been very supportive from the start of this. They never say that whenever I'm not mostly available to my family. Actually, whenever I was not, my parent, my father, mother, and my wife, they are very supportive. They always say, no, for patient is first, then is it. Last week, my father was admitted in the hospital. He has some surgical procedure. So he was again telling me, no, please go to your work. I am the patient of other department. They are taking care of me. Please, you go to your patient, you go to your department, you take care of your duty. So their support is, you have a support, you have backing from your family. That is very important. Then you can मजे कहते हैं ना वो मजे से काम कर सकते हो, because you have no liability, पीछे कुछ है नहीं कि नहीं आना है नहीं वो करना है. So then, and making a career in burns is very easy. I am telling you on this platform. People are thinking that there is nothing. There is a kick. When you see a ray of hope in a patient, when you see a smile on the face of a patient, this gives you a real kick that I have to do something for this patient.
सच में सर किसी में भी नहीं आता सर. एक्चुअली मैं इतना बर्न्स पेशेंट को मैंने ट्रीट किया था, जो ट्रीट करने टाइम में मेरे को लोग हमको देख के डर लगता है कि हम लोग आ रहे हैं, मतलब उन लोगों को लगता है बहुत ज्यादा पेन देने वाला है, ड्रेसिंग्स करने वाला है वैसे. बट वो डिस्चार्ज होने के बाद जब वापस आता है ना सर, वो सर डॉक्टर साहब कहाँ है सर आप लोग, कितना
and they are looking for you. वो तो आपको ढूंढते हैं.
हाँ वही सर,
वो तो आपको ढूंढते हैं. They are looking for you. पता, I will tell you one. I have a lot of stories. We should not deviate. I have a story. My wife was with me. We were traveling. We were traveling abroad, and from then there was the cab sort of thing. We were traveling from the airport there. So I was just talking to my wife. She was on my side. I was talking to something to her. A person was sitting on the back seat. He was not seeing my face. It was dark. पूरा अंधेरा घर. He told, "Are you Dr. Umar Farooq?" तो मैं देख रहा हूँ ये कौन बोल रहा है, तो मैंने कहा हाँ. I was your patient. I recognized your voice. He had not seen my face. To be honest, I am not praising myself. I had not a special voice. Even my parents must be not be recognizing my voice. मुझे लगता है मेरे घर वालों को मेरी आवाज नहीं ज्यादा पता होगी. So that patient, my voice was stuck. मतलब मेरी my voice मतलब मेरी वो हैरान होगी. उसने मेरी आवाज अंधेरे में वो मुझे कह रहा है कि अरे डॉक्टर उमर, मैंने आपकी आवाज पहचाना, आपने मुझे ट्रीट किया था ना 8-9 साल पहले. I was your patient. अरे बाबा, I got astonished. वो then I talked to him. What had happened? What had this? So you see, such is the bond of the patient. Because you may not be remember the patient. You have many patients. You are treating one patient today, another tomorrow, day after. But
Right.
the patient, for the patient, you are one doctor.
Right, sir.
That is the thing.
But वो
That is the thing. He picks you up.
सही. तो एक्चुअली वो आप बात कर रहे हैं, बस आपका आवाज से पहचान लिया, वो मजे किसी को भी कुछ नहीं आता.
I think this was the biggest achievement, biggest reward, award, whatever you call it for me.
सही है. सुपर सर. वेरी
So
इंस्पायरिंग.
if and मैं आपको एक बात बोलूं, treatment is anybody can treat. To be honest enough, there may be more skilled than me, more skilled than, sorry to say, than you also.
Yes, sir.
Anybody there because skill is the thing that you are. I am telling you, my mentors, my teachers, they taught me the book. They taught me the skill. They taught me how to. They taught me the medicine, how to treat a patient.
Yes,
But what is not in the textbooks, it is taught by your experience. It is taught by your patients.
yes, sir.
I advocate this. Patient आपको सिखाता है करना क्या है. He teaches you.
Yes, sir. सही है,
Patient आपको पता, patient से if you talk to a patient, actually I believe that you have 2 ears and 1 mouth. So better you listen to the patient. Give him a friendly ear. Give him a something to let him talk to you.
सही बात.
पेशेंट अगर आपको किलिंग में आता है, हाँ मेरी बात सुनिए, यू शुड नॉट जो हाँ सुना है आप बोलो जी क्या करना है, नॉट दैट. लिसन टू हिम.
सही बात.
माय टीचर ऑलवेज tells me that patient is always right. Patient is never wrong. No, there is nothing word like हम कहते हैं malingering. In medicine there is a term malingering or that.
मालिंग पेन बोलते हैं.
It doesn't exist.
जब पेशेंट पेन बोलता है मतलब वो पेन ही है.
It is my experience. Patient is always right. If he says this, don't take it. It is not there. It is there. Don't take other thing that he is malingering, he is that, he is exaggerating. There is nothing like that. And give a soft ear to a patient. Lend him an ear. Listen to him, what he is saying. And then you can interpret is likewise what you have to do, what you have to interpret from. Then you speak. So actually patients want to share, and they share many things with you, which they can. My patients are telling me that I cannot share this thing with my son. I cannot share this thing with my wife even. I am sharing with you. This is my problem. So they have some confidence in you that you can help them. If you shun them off, it is very unethical, unfortunate.
सही है. पेशेंट को आपको कॉन्फिडेंस देना चाहिए, तभी उसको आराम से बात करके.
That is the thing. मैं कह रहा हूँ ना, you treat a patient, that is medicine, whatever you treat. If a patient survives, it's a trip for us. That तो ये तो 60% burn था, तो ये बच गया जी, अब ये किया. But it is good. It is an achievement for you, agreed. But at the same time, you not take it into your head.
Right.
Now this patient has now he has a life in front of you. He has to go out. What is the meaning of that? If he goes out, he is not accepted in the society. What if you have changed? You have a patient is surviving and he is not able to do anything with his hand. Right. That's why I was telling you initially that if you are treating a patient, take the patient as a whole. हमारा ध्यान पहले जाता है, let us save his life. कोई कहता है कि हाथों को फिजियो कराओ, नहीं रहने दे. When there is no patient, when his life is saved, then we can do. You cannot do.
सही बात.
Please start everything the moment the patient enters your treatment. Whatever you have to do, whatever is the ideal, whatever is the absolute important. You have to start with the physiotherapy of that, do it. You have to do something for the ears, do it. Don't say that we're presently on the infections, we're presently on the survival. No, everything has to go
completely.
Yeah.
सर ऐसा कोई आपको एक कोई इंस्टेंट ऐसा इमोशनल इम्पैक्ट ऑफ डिफाइनिंग मोमेंट ऐसा कुछ
about?
Can you describe the emotional impact of the defining moment, sir? Any about burns?
Defining moment, I can say, when a patient comes to you, he is discharged, then he comes back with a garland for you. If he says signs of it, there are many episodes like that. Patient comes to you, he has a placard in front of you, thank you doctor, and it is written by me. And when you are treating a patient of the hand burn, and he writes a letter to you in his own with his own signature, that is a real happiness to you.
Sir, ऐसा आपको what is the biggest obstacles that you have faced in the during this mission, professionally, personally, or systematically, sir?
Obstacles and hurdles, I can see. You can say the system we have, to be honest enough. System here is not well versed or made for the treatment of such patients. You have many constraints. You want to help the patient, but at times you can't. For example, resource constraints are there. You can't help it there.
Yes.
So mostly you want to do something, but you cannot. You cannot afford. There is not affordability. I can tell you one incident. We had a patient and it is a very painful thing that repeatedly this is happening. An old lady or some patient is coming to you. He had an epileptic episode and he had a burn. And these epileptic burns are very common in our place because we have them.
Never seen, sir. 3-4 cases I have seen.
It is very cold here, so people have some gadgets of heating. Very common here is that fire pot.
Yeah.
You may have heard that fire pot we are using. When somebody has a epileptic seizure episode, he can put his hand, whatever part, any part can do it. He is not unconscious, he can. And I asked her, what was the reason? You had the episode previously, also 1 year back, you had burnt your one hand. Now you have burnt the same hand and the other hand also. What happened? Are you not aware? She told, I am aware, but the medicines I was prescribed are very costly. I cannot afford them. Make a पर्ची दिखाओ जरा क्या लिखा है दवाई लिखी है. So I will not name the medicine this time. It is really costly. It can be costly for, God forbid, you and me also. If you are taking continuously medication, so we are not taking those things into consideration. Then what I call a neurologist, I said, please have a look on the patient. He has again come. He has not controlled seizures. Please look at him. Then next day when you go there, I saw the medication. He put the same medication. I incurred the same medication. Then he is saying that this is a very good, sir, it's a very good medication. Yeah, it is costly, but it controls well. And one thing is that it has no long-term side effects. If you see the common drugs which we are using, Oxtal we are using, or phenytoin or epitoin we are using, that has a long. मैं करूँ अरे भैया ये तो दवाई ले नहीं रही है. Long term so क्या होगा ये? So you have to understand when the patient cannot afford that tablet or 5 tablets in you are supervising her in the hospital. When she is not taking that tablet that she is straight for carrying you, मुझे तो रोटी नहीं मिल रही है. It is difficult for me to what we call it to meet the both ends. How can you expect that thing? That's the final constraint. And it is, I think it's a dream. It's a dream for me that we have the burn care which is above this geographical areas. इस geographical area में burn treatment हो रहा है, नहीं तो वो rural है, ये urban है. It's a dream. Yeah, without any socio-economic factor involved. चलो some patient is a very rich person, वो तो पट्टी करा लेगा, कहीं भी करा लेगा. But you have to see the people who are, you can say, who are miserably living life, and burns are more common in them.
सही बात है. Actually, socio-economic status low, जो इतना गरीब लोग के ज़्यादा ही burns हो जाते हैं.
If you open your books also, these are the risk factors for the burns.
Yeah, right, sir. Right.
One of them is this thing.
Yes, sir.
तो जब उन्हीं में बर्न हो रहे हैं, उन्हीं को आप ट्रीटमेंट ऐसा दे रहे हो कि they cannot afford. How can it sustain? So burn management has to sustain. That's very important.
एक्चुअली ये बर्न्स जो जिनको लोग को एक्चुअली हम लोग ज्यादा अवेयरनेस बताना चाहिए सर, और उसके हिसाब से, और ये हमारा प्लेटफॉर्म भी दिया था बर्न्स फाउंडेशन हीलिंग, जो इन लोगों के लिए हम लोग फ्री में मुफ्ती में सब कुछ कॉन्ट्रैक्चर रिलीज सारा जो भी है हम लोग फ्री में कर रहे हैं सर। लोग को मालूम नहीं होता है ऐसा फाउंडेशन रहता है, और हम लोग मुफ्ती में ऑपरेशन भी करवा सकते हैं। हम लोग ज्यादा अवेयरनेस दिखाना चाहिए, और ये
Actually, that is the essence, that awareness is lacking. If burn foundation is there, healing foundation is there, it is doing marvelous job. But many people are not knowing about it.
इसी कारण के हम लोग ये पॉडकास्ट कर रहे हैं, हम लोग जो ज्यादा लोग
and adding to the how many surgeries they are doing free of cost in association with other hospitals also. It is not an easy thing.
सही है सर।
And plus, but there should have been awareness. I want to add that prevention is more important than prevention is more important. So preventive measures. First of all, I had written an article. There was a burn week last month. Last month था नवंबर में burn week था. So I wrote few articles in the daily newspaper here in our place. I wrote an article, and article was about basically prevention. Prevention is very important. So I had prevent where you are. Prevention of the burns where you are. अगर आप घर में हो, if I ask you, you ask me a question, I will ask you a simple question. Can I? चैतन्य.
सर बोलो सर.
आप मुझे बोलो, what is the most secure place where you feel you are very secure, which can shelter you? Which place do you think where you are very safe, secure, you can take the shelter?
घर है सर.
घर है ना, home. But you will be surprised. Sorry to say, you will not be surprised. You must be knowing. Yes. So sorry to say this. You must be knowing that home is the most common place where burns occur.
Yeah, सही बात. ज्यादा घर पे ही होता है.
जिस जगह को आप घर कह रहे हो, मेरा घर है, because घर is simply. अगर चिड़िया का घोंसला भी है, because चिड़िया वहां जाती है for shelter to be safe. हम अगर घर में रह रहे हैं for the safety.
सही.
But about 70 to 80% of the burns in general take place in the homes. सही. तो हमारा घर ही सेफ नहीं है. And if you come to the scald burns, जो द्रव्य पदार्थ से होता है, पानी से होता है, चाय से होता है, in children, elderly especially, they typically more than 95% occur in the homes.
Right, sir.
So जब आप prevent अपने घर में नहीं कर सकते हो, मेरा मानना है when you cannot have a control in your own place, आप घर में रह रहे हो, you don't have control that you don't have that such accidents in your home under your, you can say under your supervision. How can you say the other places? जैसे तो 10-15-20% ही तो होते हैं बाहर, इंडस्ट्रीज को लेके, वो लेके, अदर प्लेस लेके, या फायर एक्सीडेंट्स लेके, वो तो 20% ही है, और सिर्फ 75% तो आपके घर में हो रहा है. So when have we done such things to prevent it at our home?
सही बात है.
That is the thing. So basically awareness and prevention. अब मैं हमेशा पेशेंट को पूछता हूँ, किसी का बच्चा के हाथ जल गया, what did you do? कुछ नहीं, हम दौड़े, वो रो रहे थे, we went to the hospital, जो निकट अस्पताल वहां था, हम वहां पहुंचे, we went to that. कुछ किया, you give a leading question, पानी वानी डाला, नहीं, दिमाग में आया ही नहीं. And अब दिमाग में आ रहा है कि it is to be done. So awareness first, जो first aid treatment देनी है, that is very important. Awareness is very important. So burn foundation, I think we should have propagated the awareness about the prevention of the burns, about the first aid of the burns. That is very important.
हम लोग को कैंप्स कंडक्ट करना चाहिए ऐसा, हर संडे, नहीं तो महीने में एक बार, नहीं तो महीने में 2 बार जाके, और बर्न से रिलेटेड.
That is the need of the hour. We are doing fantastic job. We are making the patient doing his daily course is very important. Yes. If patient has a contracture of the hand, we are releasing his contracture so that he can take care of himself.
Yeah.
His daily course, his personal hygiene, he can take care of it. Sahi. That's a big achievement.
Sahi.
But at the start, it should not happen.
Sahi.
हमारे यहाँ रिसोर्सेज बहुत कम है. इफ यू गो टू द वेस्टर्न, उनके पास रिसोर्सेज ज्यादा है, पेशेंट कम है.
सही है.
हमारे पास पेशेंट ज्यादा है, रिसोर्सेज कम है. It is the inverse here. We have more of the number, more the patient, and numbers are such that it is not believed that we have millions of burns every year.
सही बात है.
Not हजारों में नहीं है, millions में है.
Actually, every statistics says that every year we have minimum of 5 million burns happening in India. Sir.
मैं कह रहा हूँ वही. That is why I am telling you. It is not lakh, it is not thousand, it is the million.
Yes, sir.
So how much would be the burden? So if you can tap it there, but it should not occur. That is the big thing.
Yes.
घर में अगर कोई बच्चों का, you take care of them.
सही बात.
Children are coming, वो क्या कि कुछ नहीं खेल रहा था तो वायर चबा दी. Burn is here on the face. छोटा बच्चा है, he was not been knowing.
सही है सर.
So first thing is the prevention. That is the most important. And we should advocate that we have to work for prevention. We have to work for the awareness.
Actually ये हमारा प्लेटफॉर्म दिया था सर. हम लोग अभी आगे सब लोग जो हम लोग पार्टनर्स है, सब लोग जाके कैंप्स करना चाहिए, अवेयरनेस करना चाहिए. Sir, what have the burn survivors taught you that you have never learned in medical school or in professional training, sir?
That is why I told you in earlier that they have taught me what is not in the textbooks.
Yeah, that's right, sir.
They have taught me how the life goes on.
Yeah. Every burn case.
I have seen. If you see a burn patient when he comes to the hospital, he in the initial days he is very depressed. But somehow I have found them when they are about to leave, they are very resilient.
Yeah.
You cannot imagine a person, you are dressing a patient and he is in extreme pain. Still he is accepting. नहीं जी पट्टी कर लो, कल पट्टी की थी, आज भी पट्टी नहीं हुई. He is insisting you to आज पट्टी कर दो. So amid that pain of the dressing, he has such a courage, he has such a this thing. What you can see that he has to stand up again. Every burn patient I have seen that I want to live. I have children. I have a family to rear. I have to work for them. So it apart from other trauma, to be honest, there are a lot. Burn is a trauma, a part of trauma. Apart from other trauma, I have seen that they have more will to live.
Yes.
If you see, even if it is a self-inflicted, I have seen some self-inflicted, and I totally hate the term suicidal. I never call it. Self-inflicted burns are there. So but maybe out of rage, उस second में, उस minute में, what happened, क्या हो गया, वो फिर गई खोपड़ी, उसको कहते हैं हिंदी में कहते हैं खोपड़ी फिर गई, whatever. So incident occurred. But immediately after that, they have such a strong will that we have to come out of it, we have to live.
Yes.
If it's the first instance, it is done by him or her, whatever. But
yes.
At the second instance, they have the willpower to live.
They
They teach you the lesson that we should go on.
Yes, sir.
Aarti, madam, want to say something?
Thank you as a psychologist for not calling these people suicidal and giving them that support. Really, thank you.
That is the fifth thing I told you, that fifth terms, maybe they are medically right, but personally I don't like. So I don't take it as a commodity. Don't take patient as a commodity. Don't take that. I will tell you one incident. Sorry for this story. One of my friends is in medicine, in our institution only. They had some patient with complication. He was HIV positive. So he told me we had a strange incident in the ward. What happened? So that patient told me that I got admitted. This thing came positive. I have not done anything wrong. I don't know how I inflicted this thing. But every day when you come to the rounds, you repeat the same. He's a case of this thing that with infiltrates in the chest. He's this thing, and I get embarrassed. Because it's the common ward, other people are seeing me, staring at me. Oh, इसको AIDS हो गया है. So you have to develop. Yeah, you are giving me trauma. So he is HIV positive. Remember, we are knowing because you are doing the daily rounds.
Yes, sir.
He was saying, what is wrong in it? If you give some decent term to me, I don't know what you can call me. But don't call me again and again by this term in front of everybody. Everybody is staring at me. And if you are saying you have a person drug abuse. Okay, drug, and when you call again and again, he's a drug abuser. In the rounds, he's a case of drug abuser with the extravasation of this thing and thrombosed vessels and all that, and there's the gangrene of the digits. So वैसा करके हमारी हिस्ट्री रहती है ना.
लोग बोलते हैं
बोलते ठीक है, चलो जी बोला, he is involved in that, but why to repeat again and again? Why to embarrass him again and again? After all, he's a human being.
सही बात है.
So psychological, I think psychological support is very important.
सही है सर. एक्चुअली बर्न्स बोलते हैं ना सर लोग, एक्चुअली एक सिर्फ प्लास्टिक सर्जन एक ही काम नहीं है, बहुत सारा लोग का काम है. न्यूट्रिशनिस्ट, डाइटिशियन, फिजिशियन, साइकोलॉजिस्ट, साइकियाट्रिस्ट, नर्सिंग, एनेस्थेटिस्ट, सारा सोसाइटी, सब लोग मिलके सब कुछ करना पड़ता है. बहुत
मैं तो वही कह रहा हूँ, जो बर्न का काम है, if you are calling, we are calling ourselves burn warriors, and
yes.
other is the burn survivors, and
yes.
we are made for each other. But only surgeon is not a warrior. You
right.
have warriors along the whole line.
Yes, sir.
You are one of the warriors.
Right.
Your ward boy is a warrior.
Yeah, yes, sir. Right.
His family is a warrior.
Warrior.
His family is a warrior. It is a part of him. If some psychologist is coming for his help, he's a warrior.
Yes.
Even his family is a warrior.
Yes.
His employer is a warrior. If he takes him back.
Right.
Recently, I will tell you one thing. Recently, I was actually preparing for the medical legal aspects of burn something. So I came to you see the articles, you send them the law. I came to know that it is a law that if a burn patient is there, he has a deformity, and he can go to the same profession, on the same post, with the same whatever increments and all that financial jo uska hoga, and his employer, whether government or the private, he cannot refuse him. He'll be taken to the court. If he cannot do his job, the employer is bound that he has to do some job which he can do, but he cannot demote him. And whenever he has whenever he has a due promotion, he has to be promoted.
Oh.
He has to look for his job which is suitable for him now. Maybe he's a clerk there, now he cannot work as a clerk in his office. But office cannot remove him. He is in the office. Maybe he does some other work there. So I make understand my patient that what are you doing? I'm in a firm, I'm doing this. You go back. You have a right. Please go back. So that he gets reintegrated into his job.
सर बहुत बड़ा पॉइंट बताया सर आपने. एक्चुअली ये जो पॉइंट है ना सर, ये अवेयरनेस में जाना चाहिए, सबको मालूम होना चाहिए. ये एक एक्चुअली गवर्नमेंट ऑफ इंडिया ने एक लॉ बनाया था जो आपको काम
मैं कहता हूँ जागृति जगानी है. I am telling you, awareness is to be got for the patients, for the common masses. What are their rights? We don't have only duties, we have rights also, and we have to claim them. That is important.
Sir, what innovations in burn care or survivor support you are most excited about right now, especially in Burns Healing Foundation program, sir?
I could not understand. Please, you can.
जो नया innovations है ना सर बर्न केयर में और सर्वाइवल सपोर्ट में, सर आपको क्या एक्साइट करता है सर, स्पेशली हमारा जो बर्न्स हीलिंग प्रोग्राम में है ना सर, जो हम लोग आहूजा सर ने एक्चुअली बहुत सारा प्रोग्राम्स रखाया था ना सर कॉन्ट्रैक्चर रिलीजियस में, तो उसमें क्या किया तो आपको अच्छा मतलब बहुत सारा एक्साइटमेंट आता है.
You can say what I found and we are practicing also. You can say now what is called as artificial materials are coming.
Yes, sir.
What you call skin substitutes.
Yes,
skin substitutes. I think it is a very good. We are doing a project on it, and the second project is going on recent. One we are contemplating this time. कर रहे हैं हम एक program. We are working on that, and it has a very very excellent results are there with those.
Yes,
and if you call other innovations, I can call. If you allow me, I will call negative pressure wound therapy as the innovation of the century, to be honest. We have been using negative pressure wound therapy in various forms on the burns since I think 2004, 2007 in our institution. And there are many indications for the negative therapy in burns as well.
maybe those are actually में बहुत सारा patients को burns cases में भी negative pressure.
Yeah. It has varied indications and it's an innovative thing. बाकी wounds में तो आप लगाते हो, you are applying on other wounds, other what things, composed, your exposed bone, exposed tendon, exposed hardware, whatever. But in burns, it has its own place and it's an innovative area. And patient may be free. You will do it with the graft only, where you need a flap. Or if you apply back on the second degree, we have done a project also. It can heal of its own without the grafting. And second, these what you call these skin substitutes. Nowadays, no doubt they are costly. They have cost. Restraint is there. Again, I think we are coming. Always, I have seen that we are coming to the same point again. The cost.
Yeah.
In burn, no doubt they are costly. Everybody cannot afford them, but they are a very good addition to our armamentarium in the plastic surgeons or the burn surgeons. And third, if you tell me what we are doing in, you are telling me the innovations what we have devised. If you tell me that this is the what you call this telemedicine, I can say. Telemedicine. This time also. What the patient I was calling was, he's an example. They send you photograph. They send you, now I have done this. I am doing one of my patients. He is sending me his videos. He's an adult man. He's sending me on and off. He's sending me videos. He got a job. He was not doing. He was unemployed. Now he got a job. He was telling me that I got a job in the Sachwale mein. Sachwale mein job mil gayi. Secretariat mein usko job mil gayi. So he was sending me video. I am doing this thing with the same hand. I am doing this thing. He's sending you the videos. So this telemedicine has got a good thing, especially when we were in the COVID days. People cannot follow the patients. They were sending you the video. They were sending you the pictures. Same thing is happening this time. If I need any photograph, any video of any patient for how he is doing, because nowadays everything, phone numbers are available in the files and all that. You can contact him. They can send you. This is a good thing, how the progress is going on, how the physiotherapy is working or not. He is doing his scars are going better or not. He is doing what is required.
So actually, thanks to the Burns Foundation Healing, sir, they have conducted our tele-webinar now, sir. What we are doing is tele-webinar only too, sir.
That is important. That will be the excellent.
We are all in different places and we are still talking to each other and doing a podcast also, sir. Actually.
Yeah. That is the वो कहते हैं ना, it is the magic of chamatkar, just online things and these things. They have really revolutionized these things. Webinars and how much knowledgeable we are becoming. Actually, it is not teaching only. Whether it is the teaching and learning. I think I am learning more from you than you are listening to me. That's the thing. It is the आदान प्रदान नहीं होता है. It is the knowledge sharing. It is not knowledge gaining only. It is sharing. That is the thing.
Sir, what partnerships have been most crucial to your work, sir, and why, sir?
Partnerships?
मतलब other than हमारा foundation, आप कोई partnership में काम कर रहे हो, sir? NGOs, sir.
Not much. I am just, if you say I am only involved with these things, Burn Foundation, Burn Foundation, I am involved with this only. But there is the scope, that there is a lot of scope for this thing. This is a very good question you ask me.
Yes.
So, what I feel that the common men, they can be involved with the management of the burns. Management is not that they will treat the patient, but after the treatment, they can do in the society, what they can do in the society. If we have public-private partnership in the hospitals also, that can help the burn patients. I think this is the thing which we should strive for. That can help our patients in a good sense.
Hope so. One day this Burns Foundation Healing will be integral part of each and every hospitals in majority of the cities.
Actually, the progress under the leadership of Dr. Ahuja, it is making. What I will tell you that small steps matter a lot. कहते हैं ना, every small step leads to a big leap. That's the thing. वो छोटा छोटा जो होता है ना, I have a belief कि छोटा छोटा you cannot do the big things. अगर आपको if you take the burns only, अगर आपने छोटी सी भी थोड़ी सी innovation, थोड़ी सी modification dressing में ही कर दी, which somebody can ignore also, but it will be a big addition. It can have, कहते हैं ना, छोटा छोटा, it can have small things that have big impact. So on the same lines, Burn Foundation, it is going in a long way. What it was when Ahuja sir started it was starting COVID only, na? I was present on that meeting when it was started.
Yes.
So since then, it has come a long way. You see, 100,000 surgeries are being done. Awareness programs are being done. Now webinars are being done. These podcasts are being done. And these things are not easy.
These chota chal rahe
they need a lot of, I can see, human resource, HR. Leave aside other finances and all that. HR is very important. And I can tell you, HR is the thing which people are not lending you. What I was telling you this time, abhi keh rahe the na aap, what I was telling you, how can you change, how can other people help? Or I was telling you partnership. Other people can also help. There can be NGOs. It came to my mind now. There can be NGOs. If you are doing your job, you have some spare time. You can do apart from your clinical job, you can help. There are many people, maybe in Delhi, maybe in Haryana, who are doing their clinics. If they can spare just one Sunday in 3 months, we are doing this. This is HR. You are learning your skill. It is not that I can tell you, you need money. You need, हमारे में कहते हैं, बाजू होना चाहिए. हिंदी में कहते हैं ना, बाजू भी चाहिए. You need to lend a helping hand. You need to lend a skill. Skill is with the doctor, with the surgeon. If he is lending his skill, that is his help. Some NGO is there, he is helping with the nursing and all that, that is his help. If you have somebody who is rich enough, who can help you with the monetarily, that is his help. So help can come from, there's the multiple prongs for the help that can come to but goal is the same. Our goal is the patient. We have become, that is my opinion, we are focusing on that. Our focus is the patient only, not the other things.
So what role does the Burn Healing Foundation play in amplifying your impact, sir?
Amplifying my impact. Actually, I am very much, to be honest, impressed and influenced by Dr. Ahuja's this Burn Foundation. Very much. Actually, what I can see, I will give you an example. I have worked with him when I was treating burns here. Then I went to, for a short time, I went to MAMC. He was heading the department there. And there's a very big burn department. Have you ever been there, MAMC?
No, sir.
No. It's a big department there, and there's a lot of burns. And when I saw the burns there and the management and the care, other things, some things were there innovative, which I found innovative, which we were not practicing that time. So that changed my vision. And everything was done what you can call scientifically. Oxygen karna hai ji, no, there's a time for oxygen now. You cannot do debridements and only. You have to do the burn oxygen. So that influenced me. I am very much impressed by him. So the way sir is, he is focused on the burns. Burns ko treat karna hai at every aspect. Maybe prevention, maybe the acute treatment, maybe the what you can say psychological treatment. Everything is to be done. Burn is not patti badalna, burn nahi hai. There are other aspects also. And one thing I will tell you, Chaitanya, is the respect and dignity. That I have found in my career. It is very important. Everybody has his own respect. Treat the patient with the sympathy and empathy. These are very important. Your few words can be magical for him. कोई पेशेंट कहता है ना, मैं तो आपसे मिलके ही ठीक हो गया. You have not prescribed anything. उससे बात करके, उससे आप सहनशीलता से बात करो. वो मैं कहता है land him in air, then you speak, then half of the disease is gone. उसको ऐसी सहानुभूति मिल जाती है, वो कहता है मैं तो he is a some person that I can share my thing.
तो एक्चुअली लोग हमारा बात सुनने के बाद बोलते हैं सच में सर आपका आवाज सुन के तो मेरा आधा क्या बोलते हैं
मैं कहता हूँ आधा बीमारी दूर हो गया.
ठीक होगी सर. सही है
But your tone should be like that.
सही है सर. What was your vision for your future of burn care through Burn Healing Foundation and recovery in India and beyond?
Sir, my vision can be the holistic burn management. To be honest, जो मैं कह रहा था, it is a real dream. From the awareness, from the prevention, from the acute management, from the reintegration into the home, into the family, home, into the society, and growing back to his employment. It is very important.
Right, sir.
And I have seen these burn patients that they are very much willpower. They are very resilient.
Right, sir.
And they don't shy off. Actually, they have such thing. If you can, with your scars, you can move about. I can tell you one incident. We used to live in Agra. There, few years back, I went there. I saw a new restaurant there. No, what is this? Somebody told me, "Oh, you don't know?" No, ये तो उन्होंने बनाया है. These are the acid victims. All girls there. You must have seen in the newspapers also.
Yeah.
So this is you see their courage. All the acid victims have come together. That those girls have come together. They are in the restaurant. Everybody is there, acid victim, but they are doing their job with dignity. There are no wheels. I am telling you, real success story is when a burn patient is without a wheel. वो मुंह छुपाना is nothing.
Right.
You should have such confidence that you can face the world. And I went inside I didn't have any tea or like that there, but I went inside out of curiosity to see. So I saw the girls staying in the post of manager or whatsoever they were there. Some girls were roaming here and going to tables inside. All were acid victims. That is the willpower. That is the real triumph for a burn surgeon. It is actually a this thing that हमारी परवाह होती है that क्या करना है कि हाथ ठीक करना है. क्यों अब इसकी शादी हो रही, मैट्रिमोनियल प्रोस्पेक्ट्स आर कमिंग फॉर द गर्ल और बॉय. हमारे हम ऐसा ही होता है ना इन इंडिया. इट हैपेंस लाइक दैट. हाँ जी, शादी रुक जाएगी. I told one girl, if you have a scarring on your hand and if a boy is not agreeing for your marriage to you because of this, वो कौन होता है? Leave him. He is not made for you. You are made for somebody else. If he chooses your hands, he doesn't. कहते हैं ना, you know, oh Satyam Shivam Sundaram. You are very young. You must not have known that there was a movie also.
Sir.
Satyam Shivam Sundaram. It is basically on that only. And name they have chosen Rupa. Rupa is the main character there. Rupa. And she has burn on face. She has burn on face. But burn is on the one side. I don't remember whether it is right or left. I don't remember. It's an old movie. It's actually a movie. Aarti must not be knowing. You see today, then you come to Satyam Shivam Sundaram.
Of course I know.
Huh?
No.
Actually, what that, Trinity or Trinity, what is that? Satyam, truth, godliness, Shivam, Sundaram, beauty. That is the essence, na? So, yeah, na? One side, I will tell you just one side of the faces are burnt, and some boy, he is married to her, he doesn't like her. Simply because her face is burnt, he sees that. So he leaves her. But मैं कह रहा हूँ ना, you have one dislike for a patient, you will not like me for one dislike something. But you may have so many 100 likes for other things. I may have 100 virtues which you like. So he fall for her because of other things. She had a good voice. He sing one side of it. I don't know left or right. He sing one side of face. So beauty is different. Beauty is not only of that part. Beauty is different. You may dislike a person for one thing, but you have 100 reasons to like him. So if that boy was not made for her, that girl, I thought leave him. There are so many. So give them strength. And education. Education is very important. Make your patient understand that if they are educated, they can do magics. They can go to any field, anything. What I was telling you, that boy, he did his PhD, he got in professor. He's now associate professor in the higher education. So education makes you strong. Whatever thing this is. And Burn Foundation, it is doing doing a godly work by promoting the awareness about the burns, by treating the burn deformities. And by treating the burn deformities, you are making the patients, what I was telling you, independent. That is more important, so that they can go to their own job. They can go not only on job, own roles. That is very important. They can go to their own role, what they have to play in the family, in the society. So that is the big thing.
Sir, if you could have a magic hand, what would the ideal care ecosystem looks like?
I can say the same ecosystem, what I was telling you, the dream thing, that everything is in this place. First of all, I will say prevention. It should not happen. That is the ideal thing. If it doesn't happen, that's the ideal thing. Then ideal thing, one day Dr. Ahuja was telling me in a meeting, burn meeting we were there, he met some, I don't remember his name. He's from some Taiwan or somewhere. So he is telling me there they have suits for the burns. So a burn patient comes, he's in a suit. And he was telling it is better than our 7-star hotels here. Yeah. He has a separate room, attached everything. Theater is there. Attached theater is there. Nursing staff is there. He has a surgeon with him. He has a ventilator. Whatever you need, whatever a burn patient needs, it is in the same that suit. Theater is in the same suit only. You need to operate. Anesthetist is there, so you operate him there. You do the oxygen there. Physio is there in the same room. Whatever you want, that is the ecosystem. But if you tell me, but we are resource restricted, we can think of something in between. We cannot go to very meager thing. Not we can go to higher up. So if we have to choose some path in between, we can. That can be ecosystem. We have to strive at. We have to be a warrior at every step.
Human resources.
Aware the people. Actually, we don't have awareness. We don't make aware. We actually. I think the strength of this is that you teach the people. Every year we are conducting some programs for the nursing students, for the medical students. But I am telling you, we should have such awareness programs in the schools. Because this memory of the students is small children very strong. If you go to जैसे हम दीपावली पे करते हैं, दीपावली, and it has a very good effect on the दीपावली से हम 1 महीना 2 महीने पे करते हैं ना awareness programs. These are going on, and that have very huge impact on the prevention. Similarly, in general, if we do awareness programs in the schools, that is very important. Because it will have remain in the mind of the boys and girls students. Then they can cultivate, and if then prevention at every aspect of in your homes. Whatever lenience, maybe the whatever is the temperature regulator of your geyser is there, or आपने उड़ेल दिया, पानी उड़ेल दिया बच्चे ने अपने ऊपर, तो खींच लिया उसने टेबल क्लॉथ या like that, या these are the electrical outlets are there that are unattended, child रख दिया घर में. So these are all preventive measures we have to take. Then there is the acute measure. Because my dream is that patient should not wait to come to the burn unit or burn ward or whatever you call burn specialty. Whatever he should at the first aid he should get in the district hospital in the far-flung village in India. He should be treated there in a proper way. That would be the dream. Then comes the other things. In the long run, when he leaves the hospital, when you have to do the physio, when you have to do the counseling,
Getting back into the job, everything. That is a
Coming
different,
back into the job.
different thing. Yeah.
First thing what you are saying, ideal thing is this.
Yeah.
That you treat him acutely in a better way at his own place.
Yeah.
Not to wait that you have to rush him 100 kilometers for just whether to resuscitate or not.
Right. So what can ordinary citizens do to make a difference in their community, sir, about burns?
I think I have answered it previously that they have their own duties at every level.
Yeah.
मैंने कह दिया था ना, we have one thing that we pity on the patient.
Yeah.
But don't pity on him. It is our duty. If you have one, give him opportunity. Give him dignified life.
Yeah.
It will not solve his problem with that you can give ये बेचारा हो गया, हाथ तबाह हो गया, his hand is not working, his face is very scarred. No, give him, if you have such a situation, give him employment.
Yes.
If you are not helping him, get his hand operated. If you can help him monetarily.
Yes.
But that is pitying on the patient is very bad. I don't like it.
Yes.
So do a real help to the patient, and it is the duty of the society.
So if you could change one thing about how society views burn survivors, what would it be?
Give them dignified life.
Right. That is the best thing the society is. So what do you wish more people understood about the burn survival journey, sir?
That one thing, that burns are preventable.
Yeah.
And he can really reintegrate, become normal, reintegrate into society very easily. Just you have to lend him a helping hand only. Usko haath de do, hold his hand, you can carry him to anywhere.
They have the strong resilience, sir.
Very resilient, very resilient. And we have to be strong enough.
Right,
I think leave now, we are doctors and we are a part of society. We have to be courageous enough to hold their hands.
Yeah. So what is the single most important message you want to give to our listeners to take away from this conversation, sir?
Single most important thing is that treat the patient as a whole.
Right.
I think. And do your best. One advice is, I don't know what is your best. You do your best, you do your appropriate. Don't do the easy things.
Yes.
If
What
you,
advice?
yes.
Sorry, sir. Go ahead, sir.
If you do your best, do the appropriate, do the most relevant for your capacities and capabilities. Don't do something that it is very easy, let us do it. No, you have to take the challenge.
Yes. Sir, what advice would you give to young doctors or medical students interested in burn care and philanthropy?
I will tell them that please come for the burns. It is not such a thing that you cannot. You can isme bhi pet palega easily, and it can give you a kick. It is not that you get a kick in other things.
Yes.
It is very gratifying. I can assure you, it is very gratifying to treat a burn patient. And there are a lot of lessons of life in every burn patient. Every burn patient itself can be a success story.
Yes.
It needs dedication, commitment from ourselves.
Yes. हर स्कार एक कहानी सुनाता है actually. तो ऐसा.
Always. I have found that burns is totally a different scenario from other trauma. What you see.
So when people think about your work from years from now, what do you want them to remember the most, sir?
Remember the most, I think better than calling me that he was treating the person burns. I would say they should solve that he was going alongside the burn victims, burn patient.
Very nicely said, sir, actually. This is very
so to be with the burn patients is more important. You are treating them, no doubt, this is your duty. But moving alongside the burns in their journey, in their struggle, I think to be remembered for that is more important.
Sir, abhi rapid fire hai, sir. एक sentence. So one word to describe burn survivors.
resilient, nothing else.
Best advice you ever received, sir?
There are many, I will tell you. I told you already, treat the patient as a whole, not piecemeal. Do your best to the best capabilities. And treat patient, these are more than, they're not a rapid fire. Holistic patient, treat the patient holistically. Holistically.
So what keeps you motivated on difficult days, sir?
The ray of hope. I'm always seeing a ray of hope in their eyes. If you see them, they're always looking at you with a hope that someday I will come out of this room, I will go walking out.
Yes. Your hope for the next generation of the burn care professionals, sir?
Pardon?
Your hope for the next generation of burn care professionals?
Burn care for the next generation is that they should come for this. It is very, I was already told, it is very gratifying. Come for this. It will give you a very gratifying life. And when you do one thing, that you save a patient, that you will have a very sound sleep. Very sound sleep if you help a patient like this.
Sir, if you could thank one person who made your work possible, who would it be, sir?
My parents.
Thank you. Thank you, sir.
My parents have been, and now my wife, but they have been very supportive for me. Very supportive in the whole journey. They have been very supportive.
So complete this sentence, sir. Every burn survivor deserves
dignified life, full of opportunities.
Yes, sir.
And let them give a new life, a new going on in the life.
Sir,
sir, I should stop. I think for the burn, one thing is there that they seem, वो समय जैसे कहते हैं, it थम गया है. For them, it has stopped for some time. But let we delete this thing, and their life goes on like that. I feel that dignified life full of opportunities, they should go on in the phase, post-burn phase, like that.
Sir, as we come to the close of this episode, we extend our heartfelt thanks to Dr. Umar Farooq sir for sharing his wisdom, experience, and passion for the burn care. His journey reminds us treating burns is not just about the survival, but about restoring the dignity, function, and shape. The insights shared today will continue to guide, inspire surgeons, caregivers, and learners alike. Thank you, sir, for your time, your dedication, and for being a true champion of burns, sir. Thank you so much, sir.
Thanks a lot. I am highly thankful to Burn Foundation for giving me this opportunity.